U.S. government report PDF shows a decline in life expectancy in the country for a second year in a row, influenced significantly by a surge in deaths caused by the nation's worsening opioid epidemic. The 2016 average life expectancy fell from 78.7 in 2015 to 78.6 in 2016, following a decline from 78.9 in 2014. A year of decline is one thing, 2 years in a row is a concerning trend. According to Robert Anderson, chief of the Mortality Statistics Branch at the U.S. National Center for Health Statistics, who spoke to NPR, while older Americans are living longer, younger people are dying at a higher rate. Between 2015 and 2016, death rates dropped 0.5% for 65-74-year-olds, 2.3% for 74-85-year-olds, and 2.1% for people over 85. According to the U.S. Centers for Disease Control, death rates went up 7.8% for 15-24-year-olds, 20.5% for 25-34-year-olds, and 6.7% for 35-44-year-olds. A portion of this can be attributed to the sharp uptick in opioid deaths. In 2015, 33,000 died from opioid overdoses. In 2016, that number rose to 42,200 PDF, almost double the number who died from all other drugs combined. Those increases have primarily been seen in the 15-44 age ranges. Some states have been hit worse than others. In Ohio, morgues are running out of space, and West Virginia spent $1 million last fiscal year transporting corpses. "I am not prone to dramatic statements," Anderson said, "but I think we should be really alarmed. The drug overdose problem is a public health problem, and it needs to be addressed. We need to get a handle on it." How does a life expectancy of 78.6 years stack up globally? Japan's average life expectancy, among the highest in the world, was 84.06 years in 2016, up 0.26 years from 2015. Canada enjoyed a life expectancy of 82.2 years in 2015, while the UK's was 81.1 years, 79.2 years for UK men, and 82.9 years for UK women, compared to 76.1 for US men and 81.1 for US women. Even Costa Rica, a country with far lower per capita income, and which spends far less on healthcare, significantly outperforms the U.S. on life expectancy. Research has suggested this could be partly due to the U.S.'s socio-economic inequality gap, which is much larger than Costa Rica's. The poorest Costa Ricans are living longer than the poorest Americans, which researchers link to worse access to health care and higher rates of dying from chronic diseases among impoverished Americans versus impoverished Costa Ricans. Chile, Guam, Cuba, Czech Republic, and Lebanon are among other countries that beat out the U.S. for average life expectancy as of 2015, the most recent year for which the World Bank has data for those countries. Life expectancy gives you sort of an overall sense of what is going on, Anderson told NPR, and when the figure declines, it's a clear signal of nation with a problem. The last time U.S. life expectancy last fell 2 years in a row was in 1962 and 1963, as the generation who came of age in World War II began to die of heart disease and cigarette-related cancers. According to Princeton University economist Angus Deaton, who spoke to BuzzFeed, even a single-year drop is a big deal. The last time U.S. life expectancy dropped for even 1 year was in 1993. And that was largely due to the AIDS epidemic. Large numbers of Americans have died from opioid overdoses in the last few years, and the numbers are rising. At this point, there are nearly 100 opioid-related deaths in the U.S. each day, and the epidemic appears to be accelerating, Anderson told NPR. But opioids aren't the only reason life expectancy is dropping. Suicides are up too. It's also a crisis in which people are killing themselves in much larger numbers, whites especially, Princeton economist Ann Case told NPR. Deaths from alcohol have been rising as well. So we think of it all being signs that something is really wrong, and whatever is that is really wrong is happening nationwide. The erosion of the American social safety net and widening class inequality may be behind the rising rates of what Case calls deaths of despair. They have a much more fragile existence than they would have had a generation ago, she told NPR. It may be the deaths from drugs, from suicide, from alcohol are related to the fact that people don't have the stability and a hope for the future that they might have had in the past. CDC Pennsylvania among 4 states hardest hit by overdoses. Pennsylvania had the nation's 4th highest rate of drug overdose deaths last year, the Centers for Disease Control and Prevention reported Thursday, as part of a dire analysis of addictions toll. The Atlanta-based federal agency released its latest breakdown of the cascading addiction problem, which took 600 American lives last year, 2/3 of them stolen by opioids like fentanyl, heroin and OxyContin. The CDC called that an increasing public health burden in the United States, a day after noting that it has almost single-handedly reduced American life expectancy for the 2nd year in a row. It's a vital sign of the societal health of the nation, said Donald S. Burke, Dean of the University of Pittsburgh's Graduate School of Public Health. He said the opioid epidemic is sapping our national strength. Nearly 38 out of every 100,000 Pennsylvanians died from overdoses in 2016. West Virginia topped the nation with the drug death rate of 52 per 100,000, followed by Ohio and New Hampshire at around 39 per 100,000. The non-state District of Columbia also had a slightly higher rate than did Pennsylvania. The national overdose death rate jumped 21% over the prior year, driven by a doubling of the prevalence of fentanyl in the deceased. This was a bad year, no doubt about it, said Dr. Burke. He has studied 40 years of overdose data and said the average annual increase in drug deaths is around 9%. He's never before seen a year in which it has increased more than 18%. The overall curve for 40 years has been inexorable but exponential, he said, with estimates of the number of people addicted to opioids in the millions. There are plenty of people at risk of dying, he said. Overall, unless we do something dramatically different, the curve will continue on an exponential path. According to a Drug Enforcement Administration report issued in June, Pennsylvania lost 4,642 people to drugs last year, a 37% increase from 2015. The Post-Gazette, in a special report, has detailed the effects of the opioid epidemic on the city's southern neighborhoods. The rate for the nation as a whole is nearly 20 per 100,000, more than triple what it was in 1999. The upward surge has been most pronounced since 2014, when black market fentanyl became more prevalent. The CDC reported that the fatal overdose rate for men is nearly double that for women. The rate is consistently high across the 25-54 age group. Dr. Burke said that close analysis of the data suggests the two epidemics are merging. One involves middle-aged people who were prescribed narcotics and became addicted. Another involves 20-somethings who may have started with black market opioids. We may be entering a phase of the epidemic where there is an acceptance or a normalization of heroin use, he said. Allegheny County Health Director Karen Hacker said that incomplete data for this year suggests that southwestern Pennsylvania isn't seeing any blunting of this epidemic that we are detecting at this time. With counties still finalizing overdose cases from October, some are already reporting confirmed drug death totals at or near last year's record highs. Allegheny County has already finalized 591 overdose autopsies, closing on last year's 650. Butler, Fayette, and Lawrence counties have already completed more drug death autopsies than they did last year. Dr. Hacker said that her department expects to hire, early next year, 2 new staff members dedicated entirely to addressing the opioid crisis. They'll go into hard-hit neighborhoods, she mentioned. Carrick Shaler and Millvale and start asking the residents how the county can help, plus helping people to get treatment. The department aims to reduce the problem countywide, rather than just pushing it from one neighborhood to the next, she emphasized. She said that since 2015, her department has dispensed around 4,148 kits of naloxone, which reverses opioid overdoses, and trained 4,736 people to administer the drug. Organizations like Prevention Point Pittsburgh also offer naloxone training. Dr. Hacker said the department is now exploring ways to equip some volunteer fire departments with naloxone. She acknowledged that efforts to prevent addiction have not gained enough traction. We are so busy trying to save lives that there hasn't been a big bandwidth to focus on what is going on with younger population. Maybe we'll see a technological breakthrough that will help us, said Dr. Burke. So far, though, he gave the public sector low marks for its response to the epidemic. He said that despite the rising cost of the epidemic, estimated at $100 billion per year, federal spending on addiction research, treatment and prevention over the past decade has not even kept pace with inflation. There's something seriously wrong here. Shortly after the CDC issued its overdose analysis, State Representative Brian Barbin, DeCambria and Somerset counties, introduced a bill to limit the use of pharmaceutical fentanyl for 2 years. I am hoping this bill will decrease overdose deaths and provide relief for the state's coroners, emergency medical service workers and law enforcement, he wrote in a press release. West Virginia's 25% jump in overdose deaths is totally unacceptable, said Dr. Robin Polini, a researcher at the West Virginia University Injury Control Research Center. We need a sustainable statewide naloxone distribution program, and we need to expand treatment capacity so that people who want to stop using drugs can get the treatment they need. The state with the lowest drug death rate was Nebraska, at 6.4 per 100,000. Dr. Burke suggested that the areas hardest hit by opioid addiction may be suffering from a loss of a sense of purpose, loss of a sense of community. Another word that is used is hopelessness.